Next, let's consider the B in the ABCs of sleep, back. Babies under 1 year of age should always be placed on their backs to sleep. They should not be placed on their stomachs or on their sides. When babies sleep on their stomachs and on their side, they are more likely to breathe in air they have already exhaled, rather than fresh oxygen. This can lead to oxygen deprivation. There's also evidence that sleeping on their stomach increases babies' body temperature. This can lead to overheating. Placing an infant on their side to sleep makes it more likely that they might roll onto their stomach. Studies show that when infants sleep on their stomachs, they are anywhere from 2 to 13 times more likely to experience a sleep-related death. When putting an infant to sleep, remember, back is best, or back to sleep. In some cases, you might have an infant that rolls from their back to their side or stomach on their own while sleeping. You should always place an infant on their back when you first lay them in a crib. However, if an infant can consistently roll from their back to their stomach and from their stomach to their back while awake, you do not need to move them if they roll over in their sleep. Babies may roll over at around 4 months of age. For some infants, this may not happen until 12 months of age or later. Again, you need to be sure the baby can roll back and forth on their own. This shows that they have more muscle strength and control to roll themselves onto their backs while sleeping if their body signals a need for more air. If a baby has not yet learned to roll over consistently from back to tummy and tummy to back, you should move this infant onto their back when they roll to their tummy or side while sleeping. To summarize the B of safe sleep, infants under 1 year should always be placed on their backs to sleep. If an infant can roll from their back to their stomach and their stomach to their back, you can let them remain in any position they may take while sleeping.